I don't know if it's coming out of my paycheck. Yes or no?
Britain's National Health Service has landed right in the middle of the heated debate on how to reform American health care, with ads like this running in the U.S.
In Britain, Katie Brickell denied the Pap test that could have saved her from cervical cancer.
One of the women in the ad now says,
you know, there's lots of people in the US who would benefit from a free healthcare service.
Supporters are fighting back on Twitter, on Facebook, and on the streets.
My mum was taken ill a couple of years ago. What she got, the treatment was amazing and they saved her life. So at the end of the day, I think it's really good.
You couldn't possibly run a public health organisation at the scale of the NHS without some people being unhappy and with issues, but I thank God I live here.
Physicist Stephen Hawking said he would not be alive if it weren't for the NHS. Prime Minister Gordon Brown and his wife are using Twitter to support the system, but a member of the opposition Conservative Party trashed the NHS on American television.
You are very often just sent to the back of the queue. You turn up with a complaint, with an ailment, and you're told, okay, how about October of next year or whatever it is.
His party has criticized his words. The ruling Labour Party has pounced.
In championing the American system, they're championing good first-rate health care for those who can buy the insurance, and a very poor and second-rate system for those who can't afford the insurance. We don't want that system in Britain.
So how does the NHS work? The government-run system is paid by a tax on employees and employers. With a budget of around $150 billion, it's free at the point of use. No insurance forms to fill out, no bills coming through the door. People can opt out using private insurance to pay for private doctors. The NHS buys pharmaceuticals in bulk, often at much lower prices than the U.S. Most patients pay currently just $12 per prescription, and medicine for children, retirees, the unemployed, and chronically ill is free.
Australia, population 21 million. Their healthcare system is called Medicare. Same name as in the United States, but much different. In Australia, everyone is covered. Medicare pays for an entire visit to a public hospital and reimburses a trip to the family doctor. Most medication is covered under the plan, which does require a copay. The system is funded by income taxes. Most Australians pay 1.5% of their salaries. Those with higher incomes pay an additional 1%, and there are low-income exceptions. But the public option isn't the only option, as Victor Rodwin, who studies healthcare systems around the world, explains.
Australia has a Medigap private health insurance sector similar to the French, which allows coverage of supplementary benefits and some co-payments.
Approximately 43% of Australians opt to buy private insurance as well. According to Ian Butler, an Australian doctor currently practicing in the U.S., a primary reason for buying it is that people can bypass long waiting lines for elective surgeries.
If you are sick, say with a stroke or a heart attack or pneumonia, there's really not much of a problem. But if you, say, wanted a hip replacement and you wanted it done more quickly or more expeditiously, and say by a particular surgeon, then it would be to your advantage to have private insurance.
It also helps cover costs for private hospitals and specialists not entirely covered by the public plan. Australia spends 8.7% of its GDP on health care, compared to 16% in the United States. Total annual spending amounts to $3,137 per person, compared to $7,290 in the U.S. Life expectancy, 81.6 years versus 78 in the United States. On the whole, 24% of Australians surveyed in a recent poll said their system works pretty well, compared to 12% in the U.S. Brooke Baldwin, CNN, New York.
Japanese citizens go to the doctor on average of 15 times a year. Insurance covers everyone for everything. After a fractional co-payment, the visits are basically free. Even for the elderly, long-term care and nursing homes, even home care is covered. The Japanese have a life expectancy of nearly 83 years, compared to 78 in the United States. Gerald Anderson of Johns Hopkins was in Japan to study the healthcare system earlier this year.
When they go to the doctor, it's a free service. They might pay a few yen, a few dollars for the care, but pretty much it's a free service. They can go to any doctor. They can go to any specialist that they choose. There is no gatekeeper. There's no one telling them that they have to go to this doctor.
There are about 5,000 insurance plans in Japan, all with practically identical coverage. About 1/3 of the population pay for health care through salary contributions, 4.5%, matched by the employer for a total of 9% of salary going to health insurance. People who are self-employed or with smaller companies also contribute through earnings. Coverage for public officials is identical. The government picks up the tab for people who do not work and those over the age of 70. Japan spends 8.1% of GDP on health care compared to 16% of GDP in the United States. Total annual spending, $2,581 per capita compared to $7,290 in the United States.
Then all the x-rays. There's a rotation tool for 119. There's a wrench kit.
On its face, it looks pretty straightforward. But your hospital bill is anything but. Something 56-year-old Debbie Frazier found out the hard way when she had surgery in March.
I just had to have the battery replaced on my defibrillator. I was in there 2 days, and it was $196,000.
$196,000. That's because once you strip away what you pay for your actual care, there are layers of charges that have nothing to do with your hospital stay. Take a look at Debbie's bill. Nearly $3,000 a day for room and board, $72,960 for the pacemaker, $44 for 2 Lipitor pills.
Stan Brock started this in 1985. You may recognize him from the old Mutual of Omaha's Wild Kingdom. He was a co-star of that. And now he's made it his life's work to provide free medical care for people that need it. Stan, when you look at what you're doing, what in your mind does it say about the medical situation in the United States?
Well, I think the first thing to realize and understand is that this is not anything to do at all with the economic downturn. I've been in this country many, many decades, and this situation has prevailed ever since I came to this country, and I'm sure long, long, long before that.
1,500 people here today had to be turned away within hours. You say that's nothing new to you. This is what you've been seeing. But have you seen it more recently than maybe 10 years ago in terms of the need and the willingness of people to spend the night just to get their teeth cleaned?
No, I would argue that it's been like this for many, many, many years. People simply cannot afford the healthcare system in this country unless you're either very well-to-do or very well insured. After the age of 18, because up until that time, you're protected by some type of federal and state healthcare facilities. After that, you're like the rest of us, you're on your own.